This video demonstrates central venous access device dressing change. Wipe off bedside table with antimicrobial wipe and gather necessary equipment. Gather necessary equipment including CVAD dressing kit, red biohazard bag, and face mask for patient. Perform hand hygiene with sanitizer. Identify the patient with 2 identifiers, name and date of birth.
Hi, Miss Susan. I'm going to be doing your dressing change today. Can you tell me your name and date of birth?
Susan Smith, 7/24/69.
Perfect. And do you have any allergies?
Nope, no allergies. Verify order within patient chart. Double checking for allergies.
I have an order to do a central line dressing change, and the patient has no allergies.
Explain procedure to patient, including cleaning of tube and site, length of time to complete, and reason for masks.
So, Miss Susan, I'm going to be changing your dressing on your central line. The reason that we're doing that is because it's in a big vein, so it's at risk for an infection. So we change it every 7 days. I'm going to turn your head to the side and put a mask on you just so we don't breathe any germs onto your open site.
Adjust the bed to a comfortable working position and lower rail on working side. Assist patient to a comfortable position, providing easy access to the CVAD insertion site and dressing. Set up red biohazard bag on nearby surface, not on the patient. Open CVAD dressing kit using sterile technique. Don clean gloves. Apply mask to self. Apply mask to patient and have patient turn their head away from the site.
Miss Susan, I'm going to put the mask on you and turn your head away from your CVL over here.
Remove old dressing, gently maintaining stability of the catheter, and discard dressing in red biohazard bag. Do not touch underneath the dressing while removing. Remove gloves and discard in red biohazard bag. Wash hands with hand sanitizer. Don sterile gloves. Starting at insertion site, wipe off any old blood or drainage using sterile alcohol swab. Verbalize removal of stabilization device if needed.
If there was a stabilization device, I would remove it at this time.
Using the chlorhexidine applicator, cleanse all areas with friction that will be under the dressing, including insertion site, skin, and catheter. Use a back and forth motion with horizontal and vertical strokes for 30 seconds, covering a 2 to 3 inch area. Do not wipe or blot. Allow at least 30 seconds for chlorhexidine scrub to dry before applying dressing. Verbalize application of medicated discs and/or new stabilization device if needed.
If the patient had a stabilization device, I would place that at this time, or if they had a medicated disc, I would place that at this time.
Apply a transparent dressing centered over insertion site, smoothing down all edges for dressing seal. Verbalize cap change would be completed at this time.
I would do a cap change at this time.
Remove gloves and mask from self and patient. Dispose in red bag. Label dressing with date, time, and initials without writing on the patient. Perform hand hygiene with sanitizer. Remove remaining supplies and discard into appropriate container. Lower bed to lowest position and raise side rails. Discuss documentation, including site appearance, drainage, redness, inflammation, time changed, and patient tolerance.
So I changed the dressing of the patient's right central line dressing. The appearance looked good. There was no drainage, no redness, no inflammation. I changed it on 7:30, about 1300, and the patient tolerated it well.
Maintain sterility throughout procedure.